it's me, Dr. Joann, and welcome back to this video session. I hope you still remember something from the last video session where we discussed about the 5 common myths with regards to fever. Hopefully after seeing that session, you feel much more reassured that fever is a protective mechanism in the body. Saying that, it is also very important to know how to handle fever in a child. So today, what I'm going to do is I'm going to explain how to handle fever in a child, and number 2, which is more important, what are the warning signs that you should look for that will tell you that now would be the right time to take your child to the doctor. First and foremost, with regards to fever, you will want to relieve the discomfort associated with fever. Now, fever can cause anything. It can cause your child to have headache, muscle pain, joint pains, and in fact, just a general sense of feeling unwell. Now, in choosing your fever-reducing medicine, you can go for both paracetamol and also ibuprofen. But bear in mind, what is most important is to always ensure that you're giving the right dose to your child. Giving more may not be necessarily better. Number 2, when your child is having a fever, your child is going to lose a lot of fluid from the body through evaporation. This is an important time to ensure that your child is taking adequate fluids. The fluids can be anything from drinking plain water, drinking fruit juices, or even having broth. Number 3, dress your child lightly. I know when your child has a fever, or when we have fever in general, we always tend to feel chills. You feel cold, and naturally what you want to do next is to put on an extra thick jacket or cover yourself with your comforter or blanket. But by doing so, you are only going to raise the body temperature. So dress your children lightly. Number 4, which is quite important, is in a child with fever. After giving fever-reducing medicine, of course the temperature is not going to come down magically. It's going to take time. And if the temperature is very high, for example 39 or 40 Celsius, you're going to be rather anxious until the temperature starts dropping. So what can you do next? So next would be, you can either ask your child to have a lukewarm bath or use lukewarm water and sponge your child. Generally speaking, cold water may not be very comfortable for your child. They might feel even more uncomfortable after a cold sponge, and cold water sponging can result in them feeling rather cold and they'll start shivering. Now, the process of shivering itself will cause the temperature of the body to further rise. Now that you know what to do for your child when they are having a fever, so what's next? Now, generally speaking, as I mentioned in the last session, fever is mainly caused by a viral infection. So most of the time, the fever tends to last between 2 to 4 days and should resolve spontaneously. So number 1, if the fever persists persistently for more than 3 days, then it will be a good time to see your doctor. Or the other scenario is you have a child with fever who is less than 2 years old. Now, for 2 years old and below, we know that their immune system are much more weaker. So generally speaking, for a child who is 2 years and below, if your child has a fever for more than 2 days, it will be a good time to see your doctor. Number 2, when there's signs of dehydration. Now, in terms of dehydration, one of the best ways to monitor whether your child is dehydrated or not is to observe their urine output. Generally speaking, a child who's well hydrated should be able to pass at least 1 urine or 1 wet diaper every 5 to 6 hours, and the color should range from either light yellow to straw color. If your child is unable to pass urine even once in every 6 hours, it's quite important for you to take your child to see a doctor. Now, any fever with rash, definitely you need to see a doctor. Rash is something that is not specific. It could be caused due to a viral infection or a bacterial infection. And for a lay person, sometimes it's very hard to differentiate between both of them. What's more obvious is a child who has fever and having fast breathing or difficulty in breathing. This is a definite no-no to actually keep your child at home. You need to send your child to see a doctor immediately. In a child who has fever, who complains of neck pain or neck stiffness and severe headache, one of the underlying differential diagnoses would be brain inflammation, or what we call encephalitis or meningitis. In this case, you should bring your child to see a doctor. At the end of the day, what is most important is to trust your gut instinct. If you feel that something is definitely not right with your child and you're feeling anxious and you're feeling uncomfortable, do see your doctor. We are always more than happy to help you during this difficult period. Alright, so till then, bye bye, see you.